Today I'm going to tell you an amazing story, and this story about Larry Carey, and the family members call him Miracle Larry. And he is a retired high school assistant principal. And in the middle of March, he was diagnosed with infection of Covid-19. In the early stage, he just felt he had a cold. So after a few days, that his situation is deteriorating rapidly, and he was admitted into hospital in New York City. After getting into hospital, his conditions continued to deteriorate. So the hospital put on a ventilator as the Covid-19 enlarged his lung, and he has difficult to breathe. And soon he was also in a coma because he has brain bleeding. So the doctor called Carey's family to the hospital and strongly suggesting that they should agree to take him off the life support and say that the last goodbye to Larry. Yeah, when family member come to the hospital, say that Larry is attached to all different monitors and this tube everywhere, and also have EEG on his brain. The situation looks very, very serious, and only few chance that Larry can survive this situation based on that situation. At a certain moment, he is the most severe patient in the hospital. But the family member insists that there is a miracle going to happen and refuse to remove the life support from Larry. And since his wife remembered that last text that Carey had sent him before he was placed on a ventilator, and Larry said, "I promised I will never stop fighting." And that single words gave his wife the courage and make decisions that don't remove the life support from Larry, and he is fighter. So after about 128 days in the hospital, include 51 days on ventilator, and Larry finally fight this disease and recover completely from Covid-19 infection. And so yesterday is January 22nd, he was released from hospital. And as he said, when the people asked him, what do you think your situation? He replied that, "Yes, I was in a very dark place, but I kept trying to yell, 'I'm not dead, I'm not dead, I'm not dead.'" Yes, he's really a great fighter against this Covid-19 and other disease later on was associated with this infection. This is really an amazing story, and as of today, around the world, about 50 million people was infected by this virus. The total deaths reached 639,282 deaths, and there's so many lives lost. So I think many people may be if they are fighting like Larry, maybe they can also get this life and get this life back. So the question always comes back, why some people like Larry can survive this situation and other people like this more than 600,000 people lost their life. And I can say that the positive thinking really have great impact on why Larry can survive such kind of harsh situation. Just amazing that I know he was in a very dark place, but he kept trying to yell, "I'm not dead, I'm not dead." So he always tried to fight back. This is a huge, huge impact. This is a huge positive thinking attitude. So I wish that more people just try your best and try to fight back. Never, ever give up. Yeah, you should have the spirit of survive this situation. And another important thing come out is diseases that's medical cost. And we know in the United States, the medical care cost is really, really big, and it's many people's concern. So I did some basic research. I don't know how much Larry cost for this 128-day hospital stay. We did some research to see maybe relevant situation. Here is one patient, and he's 74 years old, Michael Flo, and he will stay in the hospital for 2 months. And of course, the total cost of this for his hospital is 1.1 million. And this the total cost pages, like a book, 181 pages. This is and the major cost for his hospital is the intensive care stay. And for you to stay at intensive care unit, there will be bill you $9,736 a day. So he will stay at the intensive care unit for 42 days. So it cost him about $400,000. And another bigger cost is the medical ventilator. And this is what he was on medical ventilator for 29 days. And for each day, the charge for the ventilator was $2,835. And this is a big charge. And also another big charge for is for 2 days, and his heart, kidney, lung was all failed, so he was near death. And so because this emergency help, so use all possible drug to support it. So cost about total $100,000. You can see that the price tag for medical Larry cannot be small. It's at least, I guess, at least about twice as this, at least $2 million. And we just see another case. Is actually a relatively young guy. His name is David Nate, and he actually have spent 16 days in the hospital, and include 6 days on a ventilators. And his price tag was $320,000. So that's you can see from these two cases, you can see that price for care COVID-19 patient, and this is a huge cost for every country, for everyone. And right now, this cost, I think, based on policy from different government, and this is you're going to pay by this government or by taxpayer. So, as I mentioned, that Medicare cost is a huge issue, and that is this is one start by CNBC, and actually number one reason that most Americans file for bankruptcy is medical cost, and about 2/3 of people file bankruptcy cite medical issue as the key contributor to the financial downfall, because medical issues they cannot afford to pay. And another very important thing that most people need to know, even though you have insurance, and most people don't realize that the health insurance may not enough to protect them. So because if we come out $1 million bills, you need to pay some, maybe 20% or something, because not everything is covered. So yeah, so the medical issue is really big issue for in the United States. So the costing is really big impact to the entire economy. I don't know what is best way to overcome this cost, and because this is a huge burden to everyone, not only to poor people, but maybe also rich people, especially the middle class. And they was held in the middle. They are not afford to pay the full price, but the only way they can solve this problem is depend on the bankruptcy. This is really sad. This is the video for today. I wish to see you in my next video. Bye.